Story 1. My son, 13 at the time, said his neck hurt. The general practitioner advised him to take some ibuprofen for a strained neck. The next day, he approached me, expressing concern that he might have meningitis. We went to the emergency department at a different hospital. They examined him for 2 minutes, left, and then returned prepared for treatment. He was diagnosed with viral meningitis and spent almost 2 months in the hospital. Story 2. Metal poisoning from defective spine hardware cannot be detected on an X-ray, but I experienced all the symptoms for years. I eventually broke a rod, which prompted the insurance company to approve surgery. My back was severely damaged inside, and they had to remove the oxidized metal as thoroughly as possible. For years, doctors insisted that I was suffering from anxiety. Story 3. Not me, but my mom. About 8 years ago, she suddenly developed a strange reaction to water. Every time she would shower, her whole body would break out in hives and itch intensely for an hour afterward. She would sit after every shower crying because it was so severe. She delayed showers as long as possible just to avoid the itching. She visited multiple doctors, and they all claimed it was in her head and not a physiological response. After 2 years of suffering and showering as little as socially acceptable, she stumbled across a group of other people with the same condition. Apparently, it is called aquagenic urticaria. She discovered that taking beta-alanine, an amino acid sometimes used by bodybuilders, an hour before showering can stop the reaction. Years of suffering with such a simple solution. Story 4. I diagnosed my then 4-year-old son and my husband at the same time. Around the age of 3 to 4, my son began to bruise easily. At first, I attributed it to his being an active child. I mentioned it to his doctor, who laughed and said he was just a rough and tumble little boy. Okay, fine. Then winter came, and his bruises were just as bad as they had been in the summer, if not worse. Again, I asked his doctor, who insisted he was just a regular boy. He probably bruised himself while playing with friends. My son underwent blood tests, and the blood cell count was normal. Nothing unusual was found. It really bothered me. I just knew something was wrong. His bruises were large, and he was starting to have frequent nosebleeds. My husband also had frequent nosebleeds. He was used to them, having had them his whole life, and considered them normal, so he was not at all worried about our son. But I started to do my own research. This was before Google, so I made numerous trips to the library and browsed through many medical books. I discovered a rare disorder called von Willebrand disease, which is an inherited blood clotting disorder. My son had all the symptoms, and I realized my husband did too. A few years before, my husband had his wisdom teeth removed, and the bleeding was nonstop. He kept blaming it on poor stitches and a careless dentist. However, the dentist was fine, it was von Willebrand disease. So I went back to my son's doctor and urged him to test for this disorder. The doctor opened his eyes in shock and realized I was onto something. My husband, son, daughter, and I were all tested. It is a specific blood test that measures platelets, factor VIII, and the timing of clotting. It is not a routine blood test, which is why it was never found in either my husband or my son. It turns out my son and husband have a mild form of von Willebrand disease, while my daughter does not. It is not 100% passed on if one parent has it. Von Willebrand disease is not dangerous and does not affect their daily lives. But it is important to know if one has it. Before any type of surgery, they will need a special medication given beforehand to aid in clotting and prevent bleeding during and after surgery. Also, since they can bleed easily, they must avoid aspirin and most anti-inflammatory drugs. The good news is the bruising does lessen as they age. Story 5. My colon flipped on itself and died in 2019. It was the worst pain ever. It was taken care of swiftly. About 6 months later, I experienced similar pain in my sides. I had already undergone a hysterectomy that left one ovary. I went to the emergency room 4 times in 1 week, the last 2 times on the same day. They dismissed my pain and basically laughed at me, thinking I was seeking drugs, until it felt like I was going to die. They sent me in an ambulance around 2 to 3 a.m. to another hospital to get rid of me. I was in surgery by 6 a.m. and, sure enough, my last ovary twisted on itself and died. It was too late to save it. I went into surgical menopause at the age of 39. It was the month before COVID-19 occurred, so I could not get any relief from menopausal symptoms for quite a long time. Story 6. There might be mildly unpleasant descriptions of symptoms here. For almost a year, I experienced worsening digestive symptoms. I visited urgent care, the emergency room, and my primary care doctor multiple times during that period. Each time I was told it was indigestion or heartburn. I would explain that at least twice a week. I would wake up around 3 a.m. to 4 a.m. with crippling pain in my right side, that I often experienced diarrhea, constant stomach aches, and a strange feeling of doom, anxiety, and shaking. The doctor would perform blood tests, find nothing wrong, and conclude it was just indigestion. After my second visit to urgent care and some research online, I became convinced there was something wrong with my gallbladder. By this point, I still had all the previously mentioned symptoms, plus I experienced several episodes of vomiting, and my stool was gray almost every day, a shade I had never seen before. Online sources indicated this could be a sign of infection. Eventually, I returned to urgent care after a morning restroom visit during which undigested food was expelled. You could recognize everything. I once again explained my symptoms to the doctor. They performed more blood tests that showed nothing and reiterated it was indigestion or heartburn. At this point, I insisted they do further testing regardless of the cost. I noticed the doctor rolling his eyes, but they finally referred me for a CT scan. I wish you could have seen how things changed. As I was on my way for the scan, the doctor remarked, "It probably won't show anything anyway," sounding bored and mildly annoyed. An hour later, as I waited for the results, the doctor entered the exam room, suddenly serious and formal, and said, "Listen carefully, you need to schedule surgery right away." I was taken aback and asked, "Why do you say it as if it was me stalling?" 2 weeks later, I had my gallbladder removed. It was collapsed, infected, enlarged, and not functioning at all. I think it's honestly shocking that I went through all of that. Imagine being a doctor and hearing a patient say, "I regularly wake up in crippling pain. I feel a mass pressing on my right side. My stool is gray. I have episodes of vomiting and bowel movements with undigested food. I experience unusual physical anxiety and stress. I get chills, and more." And you respond with indigestion. To me, it was obvious there was something wrong with my gallbladder. I could literally feel it inside me, especially since it was twice the size it should have been. Story 7. My mother fell into a sudden state of psychosis literally out of nowhere. She was fine, and then she was erratic the next hour. She had no history of mental health issues, yet the doctors kept saying it was psychological, not medical. I knew they were wrong. They were trying to get her a bed in a psychiatric hospital, and I refused. Reddit led me on the path to encephalitis, which wasn't entirely accurate but partially correct, and it led to more research. I was fortunate to have a nurse friend at the same hospital who helped advocate for her, since the doctors weren't listening to me. I insisted they perform a spinal tap for anti-NMDA receptor encephalitis. With my friend's encouragement, it was discovered 6 weeks later that she had this condition, which was actually caused by a rare paraneoplastic syndrome triggered by cancer. They were able to treat it with intravenous immunoglobulin, and in a matter of days, she returned to normal. It was incredible. At that point, we then had to address the cancer, from which she inevitably passed away, but she remained her perfectly mentally sane self to the end, and for that, I am forever grateful. Takeaway. If you ever have a loved one diagnosed with something that appears suddenly, advocate for them. Do your own research. I saved my mother's life. She would have died confused in a matter of weeks without the cancer treatment, whereas when I found out, she had months as her regular self. Doctors are only human and can make mistakes. Story 8. I injured my left knee during a volleyball game. I consulted several doctors who kept telling me it was either a popped kneecap or a sprain, assuring me I would be ready to play in a few weeks. However, every time I jumped or pivoted, I would completely collapse. I had never experienced this before and became very frustrated. After several months, I suspected I had torn a ligament based on my own research. I visited a new doctor and explained my concerns. To my surprise, he agreed and referred me for scans. which confirmed that I had completely torn my anterior cruciate ligament. Story 9. A tumor was obstructing my digestive system. I knew something was wrong. I was scrawny and felt a strange pressure and pain in my side. I struggled for a year. In my early 20s and female, I didn't fully understand how my digestive system worked. Every doctor I visited diagnosed me with irritable bowel syndrome or suggested I was suffering from an eating disorder. An oncologist told me I had a herniated peritoneum but didn't provide a treatment plan. Finally, a radiologist suggested exploratory surgery, and they found a grapefruit-sized tumor blocking my pancreas from secreting digestive enzymes. After removing the tumor, the intense pain in my abdomen disappeared. Story 10. I had all the classic symptoms of hypothyroidism. I went to the doctor with my concerns. She told me I was too young for that, as I was about 22, and that I was just stressed from college. I saw 3 doctors after her, and all said I was too young and had no family history, so it wasn't possible for me to have it. They outright refused to run tests. With doctor number 4, I pleaded for help. At this point, I had bald spots all over my head. I couldn't go more than a few hours without needing a nap. I had put on almost 80 pounds while still going to the gym every day and completely cutting carbs and sugar. At one point, I had even fallen asleep while driving. I was literally crying in her office. She said, "I'll humor you and run the tests, but I know it's not hypothyroidism." About a week later, her nurse called to apologize and tell me my thyroid numbers were completely abnormal. I'm 32 now and still trying to get things regulated. Story 11. Dope-responsive dystonia. I had a stroke at birth, so my movement symptoms were diagnosed as cerebral palsy. I started progressively experiencing uncontrollable movements in my shoulders and arms, which later affected my legs in high school. In my 20s, I used a wheelchair, and by my 30s, I relied on a power chair. I lost the ability to feed myself, and my speech was impaired. After pleading with a pain doctor, I tried levodopa and carbidopa. I had been on opioids for years and struggled with addiction. Within 3 days, I was walking and pain-free. I still experience movement issues, and my disability affects most of my daily life, but I can walk and run. I am currently pursuing my 2nd degree, parenting alone, and I can drive and feed myself. Before that, I was limited to the bed, couch, or wheelchair. Story 12. Bear with me as I share my 7-year journey as succinctly as possible. I experienced worsening and chronic gastrointestinal issues, including bloating, constipation, gas, and stomach pain, along with constant pain in my lower back and increasing premenstrual syndrome symptoms such as cramps, heavy flow, blood clots, sore breasts, and fatigue. I underwent 3 colonoscopies, and each time the results were normal. My only advice was to drink more water and eat more fiber. When I had an MRI scan of my pelvis due to the pelvic pain, they discovered a fibroid the size of a quarter. While it was an interesting find, I did not believe it was connected to my symptoms. Frustrated by my inability to have regular bowel movements and feeling like a slave to my menstrual cycles, I confided in my mother. She mentioned that endometriosis ran in our family and suggested I look into it. I dismissed the idea at first because I thought endometriosis caused excruciating periods, and my cramps were not that bad, plus I questioned its connection to my constipation. At a dead end, I began researching on Reddit about fibroids and endometriosis. I learned that unexplained gastrointestinal issues were often linked to endometriosis and that it could grow anywhere in the body, even within the bowels. A helpful Reddit user recommended a specialist in my area. I consulted my primary care physician and obstetrician gynecologist about it, but they did not believe it was related. "We should just put you on birth control," they advised, but I refused. I had previously experienced negative side effects from birth control that worsened my gastrointestinal symptoms. I insisted on the referral, and my primary care physician provided it. When I visited the specialist, he quickly identified the fibroid during a pelvic exam without me mentioning it. He explained he could perform excision surgery to remove it and was confident he would find endometriosis adhesions while he was in there. I was scheduled for excision surgery in July of the previous year. During the procedure, he removed the fibroid and discovered stage 2 endometriosis behind my uterus and near my rectum. Following the surgery, I was finally able to have regular bowel movements. My periods became less painful with lighter flow, and my gastrointestinal issues significantly improved. The difference was remarkable. My specialist tells everyone, if you have a uterus and experience irritable bowel syndrome-like symptoms with no known cause, please look into endometriosis. This journey, along with support from Reddit, literally saved my life after 7 years of being misunderstood, enduring the healthcare system, and maintaining my determination to seek answers. In summary, I had unexplained gastrointestinal issues and pelvic pain for years and eventually figured out on my own that endometriosis was the cause. Story 13. My feet go numb when I bend my neck. It's like a light switch. I can turn my feet off and on with a nod of my head. It would be a fun party trick if you could see numbness. I searched online, and everything suggested it was very likely to be multiple sclerosis. So I went to my general practitioner and told him about it. He said it absolutely could not be multiple sclerosis. He couldn't even wrap his head around it being multiple sclerosis. He thought it was a bulging disc or possibly, though very unlikely, a tumor. The morning after my magnetic resonance imaging, he called me to tell me I have multiple sclerosis and to go to a specialist. I have a friend who had multiple sclerosis for decades before getting diagnosed because doctors dismissed her as a hypochondriac. I'm thankful my doctor ordered the magnetic resonance imaging for me even though he didn't believe it could be multiple sclerosis. Story 14. I didn't have a name for it, but I knew that I was bleeding heavily during my periods and that it could be life-threatening if it continued. All of the doctors dismissed my concerns, saying, "Oh, that never happens." Until I saw a gynecologist at the Veterans Affairs Hospital in Orlando who confirmed that it does happen. The condition is called adenomyosis, which occurs when the uterine lining grows into the muscle of the uterus. It causes intense, extremely heavy bleeding that could have been fatal if left untreated. I was in a weakened state due to iron deficiency. My level was at 3 while normal levels are around 40 to 50. The medical team was surprised that I was able to function with such a low iron level. I required an iron transfusion and a hysterectomy. I was relieved to be rid of my uterus and do not miss it at all. They advised me that if I experienced any bleeding during the week before my surgery, I should go to the emergency room for a blood transfusion. Story 15. In the summer of 1998, I experienced numbness on the right side of my body. I told my mother that I thought I had multiple sclerosis since she had it. She took me to my pediatrician, who informed us that I was too young for multiple sclerosis. Fast forward to September 2000, when I lost the eyesight in my left eye. I consulted a different doctor, and it turned out I have multiple sclerosis. Story 16. It felt like someone reached inside my chest behind my ribcage and suddenly squeezed really hard and didn't let go. I walked into the emergency room and told them I was having a heart attack. I am in good shape, look 20 years younger than I am, and have low body fat. 2 doctors said there is no way I could be having a heart attack. My own doctor had told me years before that if I ever thought I was having a heart attack, he wouldn't even go to the emergency room because men like me never have heart attacks. I ignored that advice and was in the emergency room 4 minutes after I had chest pain. The hospital is 3 blocks away, so I didn't even wait for an ambulance. I walked. They can easily do a blood test to find out, so they performed the test. I called my brother while I was there and told him I was having a heart attack, but the doctors corrected me. It was not a heart attack. Just then, the blood test came back, and one of them said, "He's having a heart attack." There was a complete blockage of the main artery, known by its nickname, the Widowmaker. There is an 11% chance of survival if it starts outside a hospital, like mine did. The 8 other people who had one around the same time I did are all deceased. 1 stent later, I woke up feeling better than I had before my symptoms started. Story 17. I was certain that I had broken my back after delivering my first child. The anesthesiologist insisted it was just my body adjusting and that I had a low pain tolerance. I was advised to walk it off and that it would eventually get better. Turns out I had 2 fractures in my sacrum. I must say my pain tolerance is much greater now. Story 18. Hashimoto's. I paid out of pocket for thyroid blood tests. When I explained to my general practitioner why my results indicated Hashimoto's disease and hypothyroidism, he had to search online to confirm what I was saying. This was after almost 6 months of debilitating symptoms and 2 emergency room visits for supraventricular tachycardia, as well as a concussion from fainting and hitting my head on a countertop. Story 19. I was misdiagnosed by 3 doctors at the age of 20 with a tumor in my neck that was rapidly evolving. By the time my left face was paralyzed due to 7th cranial nerve palsy, I consulted a 4th doctor and begged for a biopsy, as I had been dismissed as having a cyst. After that experience with surgery and radiation, I decided to pursue a career in medicine and become a physician who would non-negotiably provide humanity and reassurance, which I did not receive. Story 20. Nasal polyps. For years, I was told I had a cold or hay fever. No, I have had a blocked nose for 2 years. I know what hay fever is. It's not this. Please look up my nose. No, you're barely 20, way too young for them. Later, a family friend who was a doctor and retiring had me referred to a private clinic using National Health Service funds. Something you could do back then. If they couldn't see you within a set time, they'd send you privately. In my first meeting with the ear, nose, and throat doctor, he took one look up my nose and immediately referred me for a CT scan. I had so many polyps, I felt like I had 20 pounds of polyps in a 5-pound bag. For those wondering if you have nasal polyps, beyond the nearly permanent blocked nose, one key sign for me was when blowing your nose, you feel something like a giant mucus plug shift and move a little, but it never comes out, as if it were tethered on a string up there. You blow and blow, get blood in the mucus from the force, and it still won't come out. This infuriating obstruction won't budge. That's a polyp. It is literally tethered by a string of tissue, allowing it to move a little, but it can't break free, much like a marble in a bottle too big for the neck to escape. Story 21. Angioedema. I spent 6 months in pelvic floor physical therapy for severe abdominal cramps and bloating that were attributed to my pelvic floor. Then my general practitioner informed me that I was waking up gasping for air due to anxiety related to menopause, and that hormonal changes were responsible for my sudden weight fluctuations. After that, my eye doctor indicated that my eyelids were swollen almost shut because of blepharitis. Subsequently, I began passing out and vomiting unexpectedly, even though I otherwise felt fine. I researched all my symptoms, diagnosed myself, contacted my cardiologist, and stopped taking my angiotensin-converting enzyme inhibitor that same day. By day 3, all symptoms had resolved. Story 22. Gallbladder issues. It took 16 years of gallbladder attacks for a doctor to finally take me seriously. Every time they performed imaging, they said I was fine since I had no gallstones. This time, I went straight to a general surgeon, and he immediately recognized that I was in extreme pain and had not been able to keep food or drink down for a while. After he removed it, he told me it was severely scarred from years of inflammation and had numerous adhesions. Story 23. My feet were swollen when I was about 7 months pregnant. I know this is typical of pregnancy, but it was concerning. I also recognized it as a warning sign for preeclampsia. I mentioned it at every appointment, but the doctors kept dismissing it. They didn't even examine me. Guess who was diagnosed with severe preeclampsia and had to undergo an emergency cesarean section? I now have lingering blood pressure issues that I will likely deal with for the rest of my life. At least my baby is okay and absolutely adorable. Women need better health care. Story 24. Valley fever, or coccidioidomycosis, is a fungal respiratory infection that is endemic to the American Southwest. I was living in Seattle at the time and working in Southern California, an area notorious for valley fever. Doctors in Seattle continuously dismissed my symptoms as a chest infection until they eventually took an X-ray and discovered that my lungs were indurated with fungal hyphae, resembling blue cheese. After I insisted on a blood test to detect it, I had told several doctors that I suspected it was valley fever and that it could be confirmed with a simple blood test, which they refused to perform. Once I developed a distinctive rash around my neck, I knew it had to be valley fever, so I went to an emergency room and refused to leave until they conducted a blood test. An orderly did not appreciate my attitude and threatened to throw me out of the hospital. But fortunately, a nurse intervened and drew blood. The next day, I received an excited message from the hospital's pulmonologist informing me that it was the first case of coccidioidomycosis they had ever seen. Story 25. Heart issues. The first doctor I consulted after experiencing a palpitation attributed it to anxiety and prescribed anti-anxiety medication. Months later, my new family doctor recommended a 3-day Holter monitor, which revealed atrial fibrillation. Since that time, I have experienced 2 episodes of ventricular tachycardia at a rate of 210 beats per minute, each lasting about 15 to 20 minutes. The doctor assures me these are harmless, but the atrial fibrillation requires monitoring. Despite this, the condition was not caused by anxiety. I am still on the waiting list for a cardiologist after 2 years. Story 26. I had been suffering from left hip pain for years. I had a strong feeling it was something like hip dysplasia. I received multiple corticosteroid shots for bursitis. I consulted an orthopedic doctor who said it was nothing. Months later, I fractured the other side of my pelvis in an accident. After 3 months of relying on the injured hip while using crutches and mostly being bedridden or in a wheelchair, my legs had atrophied significantly. When I was cleared to bear weight again, I had a pronounced limp, so severe that I couldn't complete a full grocery shop. The orthopedic physician overseeing my recovery said it was nothing and that I would get stronger. I asked him to look closer, but he still found nothing and referred me to a back specialist. There were a few minor issues, but nothing severe. They sent me to a pain specialist to receive an epidural injection in my back. To his credit, he was the only doctor to really assess me and mentioned that my movement and complaints might indicate an issue with my hip. Still, he did not order an additional scan. We had to ask a family friend to write up the MRI results. I took them back to the second orthopedic specialist who had initially dismissed me, and he said, "Well, look at that. You have a vascular necrosis, and you need a hip replacement as soon as possible." Needless to say, I found another orthopedic surgeon to perform the actual replacement. Story 27. Endometriosis. I knew that was what was wrong with me. I had lost my appendix to it and had a previous surgery years before, but they kept telling me it was just a cyst and that I would be fine. After 43 days of agonizing pain, almost 60 pounds of weight loss, my hair falling out, and being unable to eat, I actually called people on Christmas and said my goodbyes because I knew I was dying. My parents knew I was dying. They sent me for another CT scan, but then we had a snowstorm, and no one bothered to actually look at the results for over a week. When I went back in to see my gynecologist after being shuffled from a primary care physician to a holistic provider and finally to an obstetrician gynecologist, we looked at it together. He had an ambulance come immediately. The damage was so severe that it had ripped apart my colon and bowels, leaking E. coli into my system, and my organs were slowly shutting down. My doctor told me it was not possible for endometriosis to kill me, but he was wrong. It took me absolutely harassing them for 43 days before they paid attention. I went in every single day for blood tests, which indicated a huge red flag they could not figure out, and to be weighed because I needed my doctor to see I was failing. They didn't care because they had no idea what endometriosis was or just how bad it could get. They took everything, including any chance for me to ever have children, with their incompetence. Story 28. It's worse when you yourself are a doctor, though not a surgeon or radiologist, and they don't believe you. I went to my primary care physician for pain consistent with acute appendicitis. To be fair, I didn't have many of the typical symptoms. My primary care physician doubted it, and it took me 10 days to get a CT scan to confirm the diagnosis. I had to point it out to the radiologist who had initially overlooked it, but he invited me to look at it with him. In surgery, it was red and angry looking, but fortunately hadn't ruptured. So, even fellow doctors get dismissed sometimes when you are unlucky enough to have something outside the mainstream. Story 29. I bet there are many of us who knew we had endometriosis, but doctors disagreed. My doctor dismissed my concerns and kept telling me my symptoms were due to a tipped uterus. Finally, I needed a hysterectomy for fibroid tumors caused by endometriosis. They had to scrape one of my ovaries off of my bowels because it was adhered to them with endometriosis. Months later, I reported that I was experiencing a lot of pain that matched symptoms of adhesions. She tried to refer me to a gastroenterologist, but I insisted it was adhesions from the hysterectomy. She made me wait a year for the surgery, claiming that was the soonest I could have a non-emergency procedure, which I later discovered was not true. When she finally performed the laparoscopic surgery, she woke me up all excited, exclaiming that she couldn't believe I knew the diagnosis. She didn't believe me because the pain was widespread in my abdomen. It turned out I had adhesions all over my abdomen. I have been told I was wrong when I was actually right so many times that I could write a book. Doctors have nearly harmed me more than once. Story 30. I wasn't so much unable to figure it out, but rather surprisingly indifferent. I mentioned to my doctor that I was tired all the time, and they responded that I should just lose weight, comparing my condition to carrying a heavy bag of water softener salt. Eventually, I managed to get a sleep study, and the results showed that my sleep apnea was severe. Story 31. My son had pyloric stenosis when he was just a month old. I brought him to the pediatrician every day for 2 weeks. Each time I saw a different doctor in the practice. All of them told me my son was just a spitty baby. I explained that whenever he ate, he would vomit violently, often splattering across the room and coming out of both his mouth and nose. I kept insisting that I thought it was pyloric stenosis, as it fit all the symptoms, but they dismissed my concerns, making me feel like a worried new mother. I quit breastfeeding because one of the doctors suggested it was due to my milk. Another doctor poured out 2 ounces of water to demonstrate how much his vomit resembled that amount. I didn't sleep during the entire ordeal. It was horrible. Finally, when my son was 6 weeks old, I took him in and saw the head doctor of the practice. He ordered an upper gastrointestinal examination for the next morning, and I was so relieved. During the examination, it was evident how the barium mixture flowed into his stomach and quickly bounced back out. The technician was shocked by the volume and intensity of the vomiting. He had surgery the following morning and has been perfectly fine since. Story 32. I had a cramp in my leg that wouldn't go away. After 3 days of what felt like the worst cramp I've ever experienced, I researched and discovered it could be a deep vein thrombosis blood clot. I went to the emergency room and expressed that something was seriously wrong. They dismissed my concerns, suggesting it was not a blood clot, and called me an addict, accusing me of seeking drugs. Given that I was on birth control, overweight, and had a family history of complications from blood clots, I fit every criterion for high risk. I insisted I didn't want medication. I just needed answers. I informed them I had private insurance that would cover everything, and I had contacted my family about the situation, warning that if they did not perform any tests and I died, my family would take legal action against the hospital. Consequently, they involved their lawyer, and the attorney advised them to conduct the necessary tests. The results showed a complete blockage in my knee. The cardiologist informed me that if I had gone home, it would have been fatal. A few weeks later, I experienced a mini-stroke due to complications but fully recovered, except for struggling to remember people's names. Story 33. My daughter woke up one day with half of her neck swollen, and she couldn't move it. It was red and hot to the touch. I took her to the doctor, who said she had slept on it wrong, but that didn't sit right with me. It was getting worse, and it was becoming hard for her to breathe. I felt she may have been bitten by something that caused an allergic reaction, but they just said it would go away. We gave it some more time and followed the doctor's instructions to ice it. Nothing helped. I took her to the emergency room, and my daughter, who is 6, was scared and in so much pain. A doctor came in and tried to forcibly straighten her neck, which led to her screaming in agony. I started to cry and asked him to stop. It clearly wasn't helping. He told me I was making it worse by panicking and being the hysterical mother, and continued to press and pull on her neck. I asked if it could be an allergic reaction or an enlarged gland. He said no, it wasn't possible. We left and it swelled worse. When I got home, I called my mother, who is a bit of a hypochondriac but also very knowledgeable. I explained the situation and she said to give her Benadryl. It sounded like a spider bite on a lymph node that we couldn't see due to the swelling. I did just that. The swelling was gone that night. She could move her neck the next day, and we could visibly see the bite mark. To this day, I still think about slashing that doctor's tires for being so unpleasant at the emergency room. Story 34. I noticed an abnormality in my eye accompanied by significant pain. I went to the emergency room, informing them that I suspected a corneal ulcer. The doctor dismissed my concerns, suggesting it was likely a viral infection. I pointed out that the lesion was visible to the naked eye. I reiterated my belief that it was an ulcer, as I had experienced one 15 years prior and understood the need for immediate treatment to protect my eye. The doctor pushed back, but I insisted on a referral to an ophthalmologist and eventually received one. The ophthalmologist confirmed it was indeed a corneal ulcer, and it was a severe case. He stated that without treatment within a few days, I could have lost vision in that eye. The condition was also resistant to medication, leading to 2 months of treatment with frequent powerful drugs. I was, in fact, on the brink of needing a corneal transplant. In summary, I was frustrated with the emergency room doctor for not listening. Story 35. I knew I had a tumor and went to see a neurologist because I have a neurological condition. He refused to perform an MRI and sent me all over for tests. After 6 months, he finally decided to do the MRI, and I was correct all along. Although the tumor had grown so large, I was weeks away from dying. I had major surgery and experienced significant health complications as a result. But I'm still alive, and that's all that matters. Story 36. Attention Deficit Hyperactivity Disorder and Autism Spectrum Disorder. It took a long time for me to gather the courage and execute the necessary steps to pursue referrals and undergo the diagnostic process, but I eventually succeeded. It's important to note that many women are often misdiagnosed with depression and anxiety and must navigate numerous challenges to obtain an attention deficit hyperactivity disorder diagnosis. However, once there is a name for it and a proper medication regimen is established, it is life-changing. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.